Have adoption and pricing of oncology biosimilars changed since 2020? What's the latest on influenza vaccination and antibody responses to the influenza A H3N2 subclade K? Did decriminalization of psilocybin in Oregon and Colorado impact usage? This and much more on today's JAMA Editor's Summary. Hello and welcome to listeners all around the world. Today is Friday, March 13th, 2026. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. Today I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hey Preeti, let's get started.
Hi, Linda. Let's start with the research article by Dr. Robinson and colleagues about biosimilar cancer drugs. As our listeners know, biologic drugs for cancer treatment are a major source of healthcare spending. Lower-cost biosimilars are now widely used as patents have expired. This study analyzed claims from more than 66,000 patients covered by Blue Cross Blue Shield at more than 1,500 U.S. hospitals from 2020 to 2024, focusing on bevacizumab, trastuzumab, and rituximab and their biosimilars in outpatient settings. The investigators assessed several things: whether hospitals pay less for biosimilars and earn higher markups, whether insurers are lowering reimbursements, and whether price changes affect biosimilar adoption. The authors reported between 2020 and 2024, hospital acquisition prices for biosimilars fell sharply, between 60 to 72% per year, while insurer reimbursements declined more slowly, between 32 and 36% per year. Hospital markups increased, and the percentage share of biosimilars increased to 93% for bevacizumab, 87% for trastuzumab, and 84% for rituximab by 2024. The authors highlight a need for improved payment alignment.
And in their accompanying editorial, Dr. Sachs and colleagues commented that while hospitals have increased biosimilar use and benefited financially, reimbursement inefficiencies mean savings are not fully shared with insurers or patients. The authors write that faster, more equitable biosimilar uptake could be achieved through policy reforms like blended payment rates and capping add-on payments. They emphasize that decisions should be tailored to individual health systems and patients, and further steps are needed to lower overall drug spending. Preeti, let's turn to some JAMA research letters.
Sure, Linda. In this timely research letter by Dr. Wong and colleagues, authors studied antibody responses in 46 healthy adults who received the 2025 trivalent inactivated flu vaccine in Boston, Massachusetts. Serum samples were collected before and 3 weeks after vaccination, and neutralizing and hemagglutination inhibition titers were tested against vaccine strains in the 2025 vaccine, a prior strain, and 2 emerging H3N2 subclade K variants. The investigators found that the antibody titers to H3N2 subclade K were significantly lower at baseline and after vaccination compared with the other strains, indicating the H3N2 subclade K partially evades both prior immunity and the current vaccine. However, the modest boost of antibody titers following immunization suggests that the vaccine will still provide some benefit against the H3N2 subclade K.
And in another research letter, Dr. Black and colleagues investigated whether state-level decriminalization of psilocybin affected its use in Oregon and Colorado using data from the Survey of Non-Medical Use of Prescription Drugs, a national online survey with more than 441,000 adult participants from 2018 to 2025. The authors reported that in Oregon, annual psilocybin use increased by 2.1 percentage points after decriminalization in 2020, equating to about 90,000 additional users. There was a smaller, non-significant increase of 1.8 points in Colorado, which the author suggests may be due to limited post-policy data. Results were consistent across demographic groups and suggest decriminalization may encourage both regulated and unregulated psilocybin use. The authors recommend that policymakers balance the potential benefits, such as mental health treatment, with risks like impaired cognition and hallucinations, as broader decriminalization could have important public health implications.
Let's review the latest JAMA viewpoints. In their viewpoint, Dr. Bashian and colleagues highlight that regulatory uncertainty and lack of clear national guidelines are leading to inconsistent use of normothermic regional perfusion, or NRP, in organ donation after circulatory death, despite evidence supporting its benefits. They call for explicit national standards and oversight to improve access to organ transplantation, ensure ethical consistency, and maintain public trust. In their viewpoint, Dr. Hasid and Dr. Kafarani argue that administrative delays in patient access should be treated as safety events, not just operational issues. The authors write that until access failures are recognized as safety failures and high reliability principles are applied accordingly, patients will continue to bear the consequences of systems that function acceptably on paper but fail them in practice. And in their viewpoint, Dr. McCary and colleagues from the U.S. Food and Drug Administration offer more information on biosimilars. They describe the FDA's new reforms like reducing burdensome regulatory criteria for biosimilars and promoting biosimilar interchangeability to help lower drug costs for patients.
There's plenty to learn from the newest clinical education content at JAMA. Dr. Shen and colleagues authored a translational science review on obesity and cancer. The authors describe how obesity contributes to cancer risk, noting that overweight and obesity account for about 10% of the new U.S. cancer cases yearly and up to 50% for certain cancer types. Treatments such as bariatric surgery or GLP-1 medications can modestly lower obesity-related cancer risk. Clearly, more research is needed to determine how best to combine weight loss treatments. One of the review's co-authors, Dr. Iyengar, joins JAMA Deputy Editor Dr. Mary McDermott on the JAMA Clinical Reviews podcast. They discussed how excess weight may increase cancer risk through underlying biologic mechanisms and discuss emerging strategies for cancer prevention and therapy in individuals with overweight or obesity.
JAMA has an Insights article and a patient page on the topic of peanut allergy, which affects about 2% of individuals in the U.S. The Insights article by Dr. Anna Gnastu and colleagues covers several key issues around treatment and prevention, including the introduction of peanuts to the infant diet. The patient page is a great resource for anyone who wants to learn more about peanut allergy.
And in the newest JAMA Plus AI Conversations podcast, JAMA Plus AI Editor-in-Chief Dr. Roy Perlis and Dr. Wachter have an engaging conversation and discuss how AI in medicine may impact clinical practice and medical training.
And as always, there's a lot happening in health news. The JAMA Medical News team has a summary podcast that publishes every Friday and gives our listeners insight into the latest medical news. You can subscribe at jamamedicalnews.com or click on the link in this episode's show notes.
Well, that's a wrap for this week's JAMA Editor's Summary. Thanks, Preeti, and thanks to our listeners for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Daniel Morrow, Shelley Steffens, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in this episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.